So I'm going to review the paper recently published by Joe Broderick in Critical Care Explorations titled Combat Trauma-Related Acute Respiratory Distress Syndrome, a Scoping Review. Acute lung injury and acute respiratory distress syndrome are known complications of explosive injuries, but there's been relatively little data to date specific to this outcome in combat casualties. This is important because we see a very unique injury pattern after explosives that are not seen in a civilian setting. The initial search yielded 442 papers, of which 22 ultimately met inclusion criteria. There was a significant range in terms of the incidence of ALI and ARDS ranging anywhere from 3 to 33%. Once they received the diagnosis, though, the mortality rate was high, ranging anywhere from 13 to 33%. Blast lung injury, which is a described variant of this and oftentimes a precursor, has an incidence that ranges from anywhere from 1 to 40%, depending on the paper, and the mortality rate, once you receive this diagnosis, is anywhere from 11 to 56%. So clearly the lack of robust data gives us very broad ranges of results. Additionally, a major issue is that this is frequently underdiagnosed as a formal diagnosis, even though the physician may be treating the patient for this particular for ARDS or ALI, oftentimes it's not documented by name and therefore it doesn't get coded. So there's a significant coding and diagnosis problem with capturing enough of these. This is likely a contributing factor as the wide range of data we've seen here. Secondary to that, the risk factors for developing this in the military setting include inhalational injuries, blunt trauma, the development of underlying secondary pneumonia, more significant trauma rates associated with higher ISS scores, and higher rates of blood volume administration. The take-home point is that early identification of this may potentially reduce mortality, and certainly we need better data specific to this population. This paper is open access, and I've included a link in the caption, or you can always message me if you want the link to the paper or the paper itself.